Hi, thanks for joining me to learn more about Olympic Connect, an exciting new service we're getting ready to launch that we hope will dramatically improve the lives of community members throughout the Olympic region through how we address social needs. As advertised, this is our coffee hour. I have my warm beverage here and I invite you to grab or top off your own. Before we dive in, I'll take a moment to introduce myself for those who don't know me well. I'm Miranda Berger, the Director of Programs of Olympic Community of Health, including the Director of Olympic Connect. It's such an honor to serve in this role, and I'm so excited about this work. I actually began my professional career in direct services. I wasn't really sure what I wanted to do, but I knew I wanted to help people. I started off as an advocate for survivors of domestic violence and sexual assault, and I also worked as a care coordinator for individuals with severe and persistent mental illness. And in my direct service work, I felt the frustrations of not being able to meet my clients' needs, and I saw how much bigger health was than the four walls of a provider's office. And then in 2020, my son Benjamin was born with complex medical needs, and those same frustrations became personal for my family as we struggled to navigate these really, really complex systems of care. I truly believe a better approach to how we care for people is possible. I've seen the power of collaboration and what is made possible when we bring people like you together. So, thank you first for the work you do every day and for being here today. For those of you who are unfamiliar, Olympic Community of Health, or OCH, is a nonprofit organization that serves the Olympic region, which is Clallam, Jefferson, and Kitsap counties and 7 sovereign tribal nations. OCH was formed in 2017 to bring partners together from a variety of backgrounds, disciplines, perspectives, and experiences with a purpose of solving health issues through collaborative action. We're in process of launching a new initiative, Olympic Connect, and I'd like to share a little bit about that with you today in hopes that you'll partner with us on this important work. In 2021, the OCH Board of Directors adopted a new strategic plan, and through this collaborative effort, we identified a broad, overarching goal for the organization, which is to improve individual and population health and advance equity by addressing the determinants of health. Over 2 decades of research demonstrates the negative impacts of adverse social conditions on health and well-being. Poverty, job insecurity, housing instability, food insecurity, lack of educational support, social isolation, and more have been shown to impact health. Recently, investments in housing, income support, nutrition, education, and care coordination are proving to be effective strategies to improve health and to reduce the cost of care. A more coordinated and collaborative system will help us work towards our vision of healthy people, thriving communities. To this end, OCH and our sister organizations across the state are working with key state and federal funders and our local partners to establish a statewide network of community care hubs. A community care hub is a community-centered entity that supports a network of partners providing services and resources to address social needs. It centralizes administrative functions and infrastructure and has relationships with and understands the capacities of local organizations and fosters cross-sector collaboration. OCH will serve as the community care hub for the Olympic region, and we will call our hub Olympic Connect. I have a few more slides to share about this work, and there will be plenty of time for you to ask Olympic Community of Health questions. Many of you have been working tirelessly over the years to support community members in addressing social needs such as housing, transportation, healthy food, and more. So first, I want to acknowledge that the work you're doing to address social needs isn't new. Olympic Connect intends to create an aligned regional approach to how we address those social needs. Our communities can't thrive if people don't have what they need for optimal health and well-being. Currently, you might see that our efforts to address social needs are largely siloed, and there isn't a system in place to track and address gaps in available resources. Organizations providing services often have to chase grants and may not have sustainable funding to meet the need. We don't have systems in place to broadly track health outcomes to see how our efforts are paying off. Olympic Connect will bring the following to the region: funding to provide case management for social needs, funding to expand and enhance social needs resources and services, funding to build capacity and provide training for the community-based workforce, shared regional technology, including a regional resource directory, which will catalog up-to-date information on the available resources and services to support and address social needs. Outreach, engagement, and communication in a variety of languages, formats, and mediums to connect people in various ways and to leverage our trusted local messengers. Data, analytics, and reporting to better demonstrate regional gaps and challenges as well as our successes, and continuous improvement. This work will start slow and will improve over time. As I mentioned on the previous slide, Olympic Connect will include robust care coordination for individuals with social needs. Community members will complete an intake process and be connected with a community-based worker, like a care coordinator, community health worker, case manager, and other titles. And that individual will walk hand in hand with them to address their social needs. Olympic Community of Health's current funding opportunity, which closes September 10th, seeks to contract with partners throughout Clallam, Jefferson, and Kitsap counties who will provide the community-based care coordination services. While we will learn as we go, we expect that Olympic Connect will add the following to the work that you're already doing to address social needs. It will strengthen the regional social service delivery, roll up individual partner data to a big picture view of regional data to allow communities to better understand service gaps and to better demonstrate our successes and challenges. It'll value the expertise of community and social service providers and support partners to focus on the work that they do best. It'll facilitate shared learning across the network to support, develop, and spread innovative models of care, and creates regional infrastructure for sustainable financing for social needs. It elevates community voice, provides technical assistance and administrative support, and has the potential to reduce social admissions that may go unreimbursed due to social bed days and delayed discharges, and has the potential to help reduce preventable readmissions for our clinical partners. In the long term, we aim to simplify and streamline the way social care is provided. This will ensure that individual needs are met timely, easily, and compassionately, ultimately improving health outcomes, reducing the cost of care, and advancing equity throughout the region. This work is a marathon, not a sprint, and we're intentionally taking time to listen, collaborate with local partners, and not get ahead of our funders. We know you're eager to learn more details on how this is all going to come together, and we're eager to share those with you as they're ready. We expect Olympic Connect to launch in early 2025. In September and through early 2025, we'll be working on robust community outreach and engagement to spread the word about this work. Initial funding opportunities are already being released, and those are to support this work and will continue to be announced throughout the fall. We invite you to stay tuned to our upcoming newsletters, which is where funding opportunities, future convenings, and key updates will be shared regularly. Beginning in September, we welcome the opportunity to come to your team meeting, coalition, or other group to share more about Olympic Connect through tailored presentations. If you have questions or just want to connect further, you can reach a team member via email at connect@olympic.ch.org. As we get closer to launching Olympic Connect, this list will continue to evolve, expand, and will include new and exciting ways that you can get involved. Washington State is a leader in this work. We're all part of building a new approach to this important work. I truly believe a better system to care for people with social needs is possible, and that together we'll build a better future for our local communities. We truly are stronger together, and OCH looks forward to working with you on our path forward. Thank you so much for taking the time to listen today. Please don't hesitate to reach out and stay connected with us via email at connect@olympic.ch.org. Thank you.